There is a record number of American workers who are leaving their old jobs for new ones. And the biggest reason? They want better benefits. And while this matters to every employer, it really matters for colleges and universities. My name is John. I'm with Remodel Health. We help employers care better for their employees. And today, I want to share with you how you can get your team on the best health benefits for higher education. Okay, the first thing you need to do to make sure your team has the best health benefits for higher education is to educate them, and they need it. Americans do not understand the core four terms of health insurance. The difference between a deductible versus max out of pocket, for example, or a co-pay versus co-insurance. This is complicated stuff and they need help. On top of that, there's tons of free things included with health plans that most people don't even understand exist. For example, preventative care or your annual checkup, for example, is included for free with health plans, but most people just don't go to the doctor unless they get sick because they're worried about how much it's going to cost them. Making sure your team understands how good of a plan you're giving them is the number one thing you can do to make sure they know they have the best. One of the things you can do is bring a team alongside you with this plan, to sit down with consultants to make sure every person understands what you're giving them and has help all throughout the year as they use their health plan to keep themselves safe and healthy. The second thing you need to do to make sure that your team has the best health benefits for higher education is to go beyond just the insurance plan itself to medical dollars. And what do I mean by this? Well, for example, if you have to go to the doctor, where does that money come from to pay for that doctor bill? Sure, there might be a copay, but what if it's a specialist? What if you have to go to urgent care or the emergency room? Where are those dollars coming from? The reality is 2 out of every 3 bankruptcies in the United States is because of medical bills. This is catastrophic for most people, and it doesn't mean that people didn't have insurance. Most of those people had plans, but didn't have the medical dollars to pay for their bills. This is where you can come in. You can make sure, get people onto a great plan, but then give them the dollars they need to pay for the bills when they happen. You can do this through HRAs, which are health reimbursement arrangements, or do HSA dollars, health savings account dollars. Lots of great strategies, but make sure your people have the money they need to pay for their medical bills when they need it. This may all sound well and good. You probably like the idea of bringing in consultants and giving a support team to your people for all year long with their health benefits. Make sure they know how good they have it. And you probably really like the concept of giving people medical dollars to actually pay for their medical bills when they happen. But where do you get more resources when group health benefits are just going through the roof in their costs? Well, the good news is that over the past decade, there is a new style of health benefits that's very similar to the way pension plans left, like old group plans for health benefits, into a 401k style of health benefits, and it saves tons of money. Seriously, 51% on average savings against the core plan. Well, what this means is you're gonna have a lot more resources to really make a better benefit for your team. Make sure and take care of them so you can retain top talent. You can find top talent finally. But how can you learn more about this whole new change in health benefits? I'd love to help you learn. Go to remodelhealth.com/webinar. I do these all the time. I believe that education is your first step into understanding what you can do to care better for your team. I'd love to have you join me. Again, remodelhealth.com/webinar. Register. I do these all the time. I'm looking forward to helping you step into the future of health benefits and to care better for your team.